Tirzepatide is a groundbreaking medication for type 2 diabetes and weight management. It belongs to a class of drugs known as GLP-1 and GIP receptor agonists. Like all medications, tirzepatide comes with potential side effects. Understanding these side effects and knowing how to manage them can help you have a more comfortable experience with the medication. Here are 10 common side effects of tirzepatide and strategies to combat them. Number 1, nausea and vomiting. Nausea is the most reported side effect of tirzepatide. In clinical trials, up to 29% of people taking Zepbound for weight loss experienced a little bit of nausea, and 18% reported it with Mounjaro for diabetes. Now, vomiting is less common, but it's still noteworthy. These symptoms usually occur at the start of the medication or after a dosage increase. The way we combat it is starting with a very low dose and gradually increasing it. You can also eat small and more frequent meals and avoid fatty or spicy foods. As always, stay hydrated. You can also consult your healthcare provider about over-the-counter anti-nausea medications. However, we use our proprietary supplement, Corebiotic, which has natural ginger extracts and other vitamins and minerals to help reduce this nausea significantly. Diarrhea is another common issue, affecting up to 23% of Zepbound and 17% of Mounjaro users. Like nausea, it often occurs at the beginning or after increasing a dose, and it can lead to frequent loose or watery stools. And you can combat it by staying hydrated and drinking plenty of fluids. You want to avoid greasy or spicy foods, limit caffeine and alcohol intake as well. Fiber is also very important while you are taking any type of GLP-1 or GIP receptor agonist medications. Corebiotic is a probiotic supplement that can also help with the side effects. Number 3, the whole point you're taking it, decreased appetite and weight loss. Yes, tirzepatide helps you feel fuller longer, leading to a reduced caloric intake and weight loss. While it's a side effect of the medication, it's also a feature when used in weight loss. Many individuals actually appreciate this side effect. If you're using it purely for diabetes management and not for weight loss, you may need to counteract this effect. So make sure you're working with a dietitian to ensure you're meeting your nutritional needs, eat nutrient-dense foods, and monitor your weight and your appetite. Discuss any of your concerns with your healthcare provider. We're here to help you. Number 4 is heartburn and a little bit of acid reflux. That's one of the small side effects of tirzepatide, and it usually subsides very quickly. Symptoms can include that burning sensation in your chest or your throat, or an acidic taste in your mouth. You want to combat it by eating smaller meals more frequently, avoiding lying down immediately after eating, and avoiding caffeine and alcohol in large intakes. You can use over-the-counter heartburn medications as recommended, or you can also use Corebiotic, our proprietary supplement, to help with reducing stomach acid. Number 5, stomach pain and swelling. Stomach pain or abdominal belly discomfort are also common. You can experience some flatulence, feeling of fullness, or visible swelling in the abdominal area. These symptoms are usually temporary, and your body will adjust to the medication quickly. Use over-the-counter medications such as simethicone or Gas-X for bloating. Eat slowly and avoid swallowing air as much as possible. If the pain is severe or persistent, always seek medical attention. Which leads us to number 6, the burning or flatulence. Tirzepatide will slow digestion, which can lead to increased burping and gas. Some users report sulfur burps, which have an unpleasant odor like rotten eggs. This is going to be very rare, but can cause discomfort or embarrassment. Avoid foods that cause gas, like beans and carbonated drinks. Consider dietary supplements like peppermint or ginger that are in Corebiotic to reduce gas. Practice yoga that helps you release gas, or use simethicone products if necessary. Number 7 is constipation. While diarrhea is more common, some people experience constipation due to slower movement of food through the digestive tract. This can lead to infrequent or hard or difficult to pass stools, but is a side effect that can be easily managed with dietary changes and taking our proprietary probiotic supplement called Corebiotic. Corebiotic has 2 excellent probiotics in it, which help naturally increase GLP-1 production while helping with digestion. You can also increase your fiber intake and drink plenty of water to help with stimulating digestion. If you need to use over-the-counter laxatives or stool softeners, make sure you talk to your healthcare provider first. Number 8 is fatigue. Although fatigue is not commonly listed, some users of tirzepatide report feeling tired. You might feel a persistent sense of tiredness or lack of energy, which can affect your daily activity. However, you can combat this by making certain lifestyle changes to feel more energetic. The first thing is make sure you get adequate sleep at night. Second, stay hydrated and eat a balanced diet rich in vitamins and minerals. We can also supplement your vitamins with B12 or lipoline in the clinic. Number 9, low blood glucose. Hypoglycemia or low blood glucose is rare with tirzepatide alone, but can occur if you combine it with other diabetes medications that increase insulin production. So symptoms can include shakiness, sweating, confusion, or dizziness. So if you are taking multiple diabetic medications, make sure to regularly monitor your blood sugar levels. Always have fast-acting carbohydrate sources with you, like glucose tablets or candy on hand, and your provider may adjust other diabetic medications to reduce the risk of hypoglycemia. Always make sure that you are following up with your primary care physician on a consistent basis while taking these weight loss medications. The last thing is injection site and allergic reactions. Redness, pain, or swelling at the injection site are rare and typically resolve on their own. Even more rare, severe allergic reactions can occur, presenting as rash, itching, swelling, severe dizziness, or trouble breathing. This should be reported immediately, or you should go to the ER immediately. You can combat this by rotating injection sites to prevent irritation, using a clean, sterile needle every single time, and immediately reporting it if you experience any symptoms of a severe allergic reaction, such as difficulty breathing or swelling in the face and the throat. Tirzepatide offers significant benefits for managing type 2 diabetes, aiding in weight loss, and helping with inflammation and cardiovascular issues. However, being aware of its potential side effects and knowing how to manage them can greatly enhance your treatment experience. Always communicate with your healthcare provider about any side effects you experience and follow their guidance to ensure the best possible outcomes. As always, like and subscribe, share this with anybody who you think could benefit from it, and thank you very much.